Dealing with something known as diabetic retinopathy. I am not going in detail of diabetic retinopathy. And at the end of this small presentation, just what you will take as a take clinic message would be that there is a disease known as diabetes, and it affects your eye, kidney, heart, brain, many other. The most important two things which affects are the eye and the kidney. And second thing which is important over here is screening. Screening is something that all diabetic patients should undergo. Eye screening and renal screening. So if a patient is normal and with good vision and normal, but he should also undergo a screening of the eye and a screening of the kidney, which Dr. Shoaib will better tell, because this diabetes is also known as a silent killer. Silent killer is what? The disease does not happen or does not manifest itself till it progresses to a very late stage. Like for example, in your nephrology, even if the creatinine is like 3, 4, the patient will be happy, patient will be good, patient will be moving around, eating all the protein, everything. When he conducts a test, when a test is done, he will know that his creatinine is high, then he starts all the treatment, whatever it is. So it is like a silent killer. So to prevent this, a screening should be done and early intervention. The earlier you intervene, the better prognosis you get and the longer the longevity of the patient. So at the end of this presentation, if you know that all diabetes should be screened for eye and the kidney, and it is a silent killer and early intervention will help. If you know these 3 points, it is more than enough for anyone to help your patient and people around you. So I think everyone has seen a movie known as Conjuring. Okay, so it's a bad example, but our disease is something like that. You go anywhere, people will do multiple hospital shoppings, but that disease won't leave you. One doctor will tell this, he will go to the other doctor will also tell the same thing. So it's a movie like a Conjuring, it's like a ghost, it will be there with you. You should accept it and start treating it as early as possible. This is what you should explain to the patient. So most important in this is the counseling of the patients, not just at the doctor level, but at every level, counselor level, receptionist level, even pharmacy level, every level. So now the basic, what is an eye? This is a cross-sectional image of the eye. When you see the layers of the eye, the outermost part, what the white part that you see is known as the sclera. The inner part is the choroid and the retina. Retina is this part of the eye, and choroid is the part which supplies blood to the retina. So this is a normal retinal image. Everyone's image will be like this. Everyone's retina will be like this. It will have a part which is known as an optic disc. This part is the most important part. This optic disc continues as an optic nerve and it connects eye to the brain. It's like a connection between the eye and the brain. And these are the blood vessels. And this area is known as the macula and this area is known as the fovea. So if you remember 4 things that are more than sufficient. Optic disc, blood vessels, macula, fovea. This is the only part in the human body where you can see blood vessels naturally. If you want to see blood vessels of the hand, you should cut yourself, or you cannot see blood vessels of your hand, your human body. But retina is the only place in your whole body where you can see blood vessels naturally. In other parts of the body, kidney, renal, artery, you cannot see. You cannot see any of the blood vessels because they are covered by skin. But this is the only place where you can see the blood vessels. Okay, so now, so diabetic retinopathy is of 2 types, simple, non-proliferative and the proliferative type. These are just 2 types of diabetic retinopathy. And now why there is loss of vision in diabetes? There are 4 reasons. I will explain each and everything with pictures in detail. One is the diabetic macular edema, one is the vitreous hemorrhage, and another is the optic atrophy. And this is the most common, that is the cataract. Okay, majority of the patients develop cataract If the retina is involved, then these three things happen to them. Now this is the shape of the eye. When you remember the old photo what I had shown you earlier, that was the normal retina. This is a retina of a patient who has diabetic retinopathy. So this is the hemorrhages that you have developed in a patient with diabetic retinopathy. These hemorrhages are 3-4 kinds, known as dot hemorrhages, blot hemorrhages, flame-shaped hemorrhages. We need not go in detail, but if you see something like this, it means that the patient has diabetes, and due to diabetes his retina is getting affected. So these are the hemorrhages that develop inside the retina. Many people have seen that, and many people have come with this kind of report also with you. You might have seen many people in a nephrology clinic. This is known as an OCT, and this area is known as the fovea. So this is a macular edema. See, when you see from here till here, this part of the retina is normal, this part of the retina is normal. When it is coming closer toward the center, this part is getting thickened. This type of edema is similar to the edema that you see in your patient with nephrology, the pedal edema. Parasujeve jo bolte hai na. The same thing happened inside the retina also. And why the swelling happens inside the legs? That is the same reason why swelling happened inside the macula. One of the reasons. Raised creatinine, osmotic imbalance, one of the reasons is that. So the same thing which happens inside the leg also happens in the retina, which is known as a macular edema. So I am just telling you an overview and basic so that you people can understand. This is again another photo of the retina. This is a proliferative diabetic retina. Proliferative means over here you can see nice bouquet-like thing, but it is not a bouquet, it is a very dense neovascularization. You can see over here red things. These are all blood vessels that has developed on the surface of the optic disc of the retina. This is a very like a danger sign, like a conjuring what I was telling, this is that. So we should treat these conditions at the earliest, because if not treated, they can go to a complete loss of vision. And this is very important, because if there is loss of vision due to this, you cannot regain back. Like in a kidney disease, if a patient goes to a chronic kidney disease stage 4 or a dialysis, he should undergo a transplant only, but that kidney cannot get back to normal. In our retina there is no transplant. जो है उससे ही काम चलाना है. So better is, there is a proverb in English, prevention is better than cure. So this works over here. If you see something like that, we should act immediately and try to save the vision as much as possible. Then there is another photo, this. So if you keep the first normal retina photo in your mind, then you can understand the changes. This is a similar, this is the blood vessel, this is the optic disc, this is a complete hemorrhage that has formed on the surface of the retina. Okay. So with this, and I will tell you what are the treatment options, what we do to treat them, but as of now, just for a picture imagination, I am showing you all these things. This is a hemorrhage. This is a patient with vitreous hemorrhage secondary to diabetic retinopathy. And now, what you should learn from, what you people should learn from all these things is, if you see a patient who is telling that he is having diabetes with this kind of thing, always ask him to get his kidney checkup. No patient with renal problem should be left alone without a kidney checkup. No patient with kidney problem should be left alone without a retina checkup. Though both occur mostly in a patient with diabetes. Either one occurs first or the other occurs first, or both occurs together. But if you see a patient like this, just tell him undergo a renal problem and advise him whatever your creatinine levels, whatever CBP, CUE, whatever you can advise him. And believe me, if the patient has a high creatinine at that time or something like that, he will always be in debt with you, because you have like shown him the correct path. But suppose with patient who has come like this to you have seen somewhere and you asked him a creatinine level, suppose his creatinine is 2.53, that is an early stage, I believe. And you can save that patient. If you haven't told him to undergo a creatinine level and it has gone to high level like 6, 7 with all the complications, then you have lost so much of time in treating that patient. So any patient, if you are seeing with eye problem, or if he has told you that he has some eye problem, please tell him to undergo a nephrology checkup. So now, what treatment we do with if we see a patient like this? Treatments that we do is, the first treatment is systemic metabolic control. That is the first treatment. Dr. Shoaib will tell you better about this. That is sugar control. That is the first treatment. Root cause of all these problems is sugar. The first thing you do is control the sugar levels. Second is control the risk factors. What are the risk factors? Like if there is associated hypertension, most of the patients will have both together. If there is associated raised cholesterol levels, if the patient is having some other issues, cardiac or renal, or raised creatinine levels, or if a patient is a smoker or with other habits. And the third will be the ocular treatment. So basically, sugar control, eye treatment, 2 treatments. So what are the risk factors? Whether a patient with diabetes, when will he develop or how will he develop an eye problem, and how to prevent it? Many people might ask you are working in an hospital, many people will ask you how to prevent kidney problem or how to prevent an eye problem who are having diabetes, because all patients with diabetes do not develop a kidney or an eye problem. Some percentage of patients will develop. So how to become that lucky patient who will not develop this problem is, first thing, if you are having a high duration of sugar levels, means if the sugar is 10 years, 15 years, 20 years, you are more likely to develop eye problem. So if you are having a high duration of sugars, ask them to strictly control your sugars. First, that is should be there. Second thing is associated hypertension, lipid profiles, if there is kidney issues, if he is having anemias, various pathologies, that should also be under control. Even after if he develops problem in the eye, then also these things should be well kept under control. And avoidance of smoking, alcohol, gutka, all those things should be avoided as much as possible or totally nullified. Then active exercise. Sedentary lifestyle is not recommended by anyone. And food habits. Food habit means lifestyle changes, eat on time, eat vegetables, avoid white rice, avoid sugars. So these things should be kept in your mind while counseling or telling any patient about eye or about any kidney issues. Now, what do you do in eye? Eye, we do 3 treatments. First would be doing a laser which is known as PRP, pan-retinal photocoagulation. Second is we give injections. Many people might have aankh mein injection di, aankh mein injection di. This is the injection. And third is the surgery. So we do 3 treatments. So this is the laser treatment that we do. This is like a green laser. This is the retina. These are all the hemorrhages. This is an animated video. So we just do the laser and coagulate all the areas of the retina. So this is just a live demo video which we are doing. This is the kind of machine we do. This is the console, and we use a lens, and this is the setting of the doing the laser. It's not a major treatment. Hardly we do both eyes at a time. It hardly takes around 3 to 4 minutes to do the laser. We usually do in 2 sittings or 3 sittings. So this is the known as PRP, pan-retinal photocoagulation. So this is the setup of the laser. We usually do green or the yellow laser. Then coming to the intravitreal injections. Mostly we give 2 type of injections. One is the steroid, which is known as Ozurdex, which is a dexamethasone steroid. And another is the ranibizumab, which is known as the anti-VEGF. There are many other types of anti-VEGFs, but this is the most commonly used. These are the most 2 commonly used drugs. This is a steroid drug, this is a non-steroid drug. And these are the things which we use. We use a 30 gauge needle to give the injection through a 1 cc needle. Okay, so this is usually the response to treatment what you get. What I was showing is, this is again a photo. You can see small hemorrhages over here, and this what I was telling is the edema. Like the same you have in the leg, pedal edema, the same edema you are having here. We have given him injection, and this is the response that you get. This is the normal retina. You can see that this edema is completely subsided and it becomes like this. This is a very good case. Every case won't be like this. This is a very good case that I have shown you. And this is a procedure of the injection that I am showing you. This is a bad quality video, but just I want to show. We use a needle, a single hand technique, and we drape the eye completely because we want it to be sterile. And this is the eye. This is the speculum. We drape it and we use the speculum to open the eye, and we use this needle to give the injection. It's hardly a 2-second procedure. So panretinal photocoagulation and this injections are not a major procedures, but they are like done in steps. Like every week you do a PRP, and my injection might be required every month, like that. They are totally painless procedures, but patient should be counseled that you should maintain his sugar level and undergo the treatment as per the protocol. Now the third thing would be the surgical intervention. This is the main step of the treatment. You don't do surgery to every patient with diabetic retinopathy. 80 to 90% patients just require laser and injection. Only 5% or less than 5% patient will require surgery when there is a dense vitreous hemorrhage. This surgery is known as a vitrectomy surgery. Okay. In this surgery, you use a cutter. This is the retina, and these are the hemorrhages that you see. You use this cutter. This is usually a 23 gauge or 25 gauge cutter, and this is the light pipe because inside of the eye will be dark. So you use a light pipe and you cut this. All these are all the blood strands which are present. This is all the vitreous hemorrhage. So you cut all the vitreous. You should make sure that you do not harm the retina. Okay, at that time. So this you use actually this is a microscopic view. It doesn't. This is a magnified view. So you use the cutter to cut all the vitreous hemorrhage. It appears very easy, but it is not as easy as it is shown over here. So now what we do is we aspirate the blood which is present on the surface of the retina. So this is very important because while aspirating the blood, the retina should not come in the port. So we should be very careful in doing that. If the retina comes in the port, then it will become another disaster. Now this is a small video.
Diabetic eye disease refers to a group of eye problems that can occur as a result of diabetes. Without diagnosis and treatment, diabetic eye disease can cause severe vision loss or even blindness. Diabetic retinopathy is the most common diabetic eye disease and is a leading cause of blindness in persons with diabetes. It is caused by changes in the blood vessels of the retina. The retina is the light-sensitive tissue at the back of the eye. A healthy retina is necessary for good vision. In some people with diabetic retinopathy, blood vessels of the retina may swell and leak fluid or blood. In other people with diabetes, abnormal new blood vessels grow on the surface of the retina. At first, diabetic retinopathy may not cause any changes in vision, but over time, diabetic retinopathy can get worse. At first, a person might see spots floating in their vision, or may notice a general blurring of vision. Eventually, diabetic retinopathy may cause vision loss and even blindness.
Okay. Thank you, everyone.
Thank you for a very detailed and interesting presentation. Just to summarize, diabetes is a killer. और डायबिटीज़ ऐसा वैसा किलर नहीं है, द बिगेस्ट किलर है हमें. वर्ल्ड का नंबर 1 कॉज ऑफ ब्लाइंडनेस जिसको हम प्रिवेंट कर सकते हैं वो डायबिटिक रेटिनोपैथी है. तो टाइम पे अगर पेशेंट को बोल सके, एवरी डायबिटिक पेशेंट अपने पास, हर जो पेशेंट आता, मोस्ट कॉमन डायग्नोसिस हर पेशेंट के पास 2 रहते हैं. क्या है 2 डायग्नोसिस धरनी अपने पास जो आते हैं पेशेंट्स? हाँ, हाइपरटेंशन एंड डायबिटीज़ दोनों भी आंखों में इफेक्ट करते हैं. तो अभी सर से अपन नेक्स्ट टाइम हाइपरटेंशन का भी क्लास लेंगे. सो ये दोनों में शुगर सबसे डेंजरस है, क्योंकि जिसको शुगर रहती है डायबिटीज़ के 80% लोगों को हाइपरटेंशन आता है, और डायबिटीज़ के तकरीबन 70% लोग एंड अप विद सम रेटिनोपैथी और नेफ्रोपैथी एंड इवेंचुअली ब्लाइंडनेस. कितने पेशेंट्स हैं आप नॉर्मल बात करते रहते हैं, उनसे पूछो, ईयर में आप पूछना मिस हो जाता, अंदर आने के बाद मैं पूछता हूँ वो तो ये आँख से दिख रहा है नहीं, वो आँख से दिख रहा है नहीं। कभी जो है काम करते रहते कुछ सफ़ेद क्लाउड के वैसा चले गया मेरे सामने से ऐसा दिखता, ऐसे ही प्रॉब्लम्स होते। तो एक क्वेश्चन था सर, ये लोग अक्सर अपन बोलते हैं आँखों का लेज़र हुआ क्या बोल के, हर एक से पूछते हैं मैंडेटरी लेज़र हुआ क्या। लेज़र से ज़्यादा आजकल इंजेक्शंस प्रेफर कर रहे हैं। लेज़र तो नहीं हुआ ऐसा गुस्से में बोलता हूँ ना, जैसा कि अभी कुछ क्या पूछा भाई, मैंने इंजेक्शन दिया मेरे को बोलता। व्हाट इज़ बेटर, इंजेक्शंस, लेज़र, एंटी VEGF या लेज़र? लेज़र मेरे को ज़बरदस्त स्टार वॉर्स के वैसा दिख रहा था।
Indications for both are different.
क्या है?
Indications for both are different. If it is a proliferative diabetic retinopathy, then lasers is a must.
Okay.
Many people who are treating, like giving injections, usually should do a PRP, because injections duration in the eye is for 1 month only.
1 month.
PRP stays lifelong, and PRP prevents recurrences. So with proliferative diabetic retinopathy, do a good PRP, that is more than sufficient.
Second thing, I have seen some patients come to me for getting clearance for retinal angiogram. उसको क्लियरेंस का जरूरत ही नहीं है, उसमें कॉन्ट्रास्ट हार्डली 1 ml जाता होगा, बट आई हैव सीन व्हाट इज द रोल ऑफ रेटिनल एंजियोग्राम खाली हार्ट में नहीं होता। एंजियोग्राम बोले तो हार्ट का समझ जाएंगे, रीनल एंजियोग्राम भी होता, आँख का भी एंजियोग्राम होता है। एंजियोग्राम की मीनिंग क्या है, कोई बोल सकते हैं? एंजियोग्राम, जेलम विल टेल। जेलम इज माई ओल्ड फ्रेंड, ही हैज ट्रैवल्ड एटलीस्ट 70 कंट्रीज एंड प्लस 30 कंट्रीज। तो उन्होंने पूरा वर्ल्ड ट्रैवल करने का शौक़ रखते हैं उन्होंने, तो जो कमाते सब खर्चा कर देते, खाली घूमना रहता उनको। तो मीनिंग ऑफ एंजियोग्राम, सॉरी फॉर व्हाट इज इट?
That is to screen blocks that they have.
नहीं, एनजीओ बोले तो एंजियोजेनेसिस बोल के सर वर्ड यूज़ करे थे।
न्यूवास्कुलराइजेशन,
तो वेसल्स को देखने का नाम एंजियो मीन्स इट्स समथिंग रिलेटेड टू द वेसल्स, एंड ग्राम मीन्स उसको देख रहे हैं कुछ कॉन्ट्रास्ट डाल के। तो उसका क्या रोल है सर?
Usually in proliferative diabetic retinopathy,
करते हैं वो,
they are done to see whether neovascularization is present or not, or any other disease entity known as choroidal neovascular membrane, FFA is used. But now usually the young brigade of retinal surgeons which are coming, they are not using much FFA.
It's not required. So nowadays things are getting more and more advanced, ज़्यादा इक्विपमेंट से ज़रूरत नहीं है उसका। बट आज का लर्निंग पॉइंट जैसा सर बोले स्टार्टिंग में कि डायबिटीज़ अफेक्ट्स 2 things, आई एंड किडनी टुगेदर, समटाइम्स वन फर्स्ट और द सेकेंड फर्स्ट। तो इट्स ऑलवेज इंपॉर्टेंट इफ़ यू सी एनी किडनी पेशेंट, मेरे से तो ज़्यादा टाइम स्पेंड नहीं करेंगे, आप सबके साथ बात करते रहता। तो जिसको भी शुगर है, आपके ख़ानदान में है, आपके महल्ले में है, आप लोग अब एजुकेटेड है, यू शुड टेल देम प्लीज़ डायबिटीज़ एनुअली चेक योर आइज, एनुअली, इट्स वेरी ईजी टू चेक, एक बार आँख बता देना। और हम लोग और भी रीजंस की और सर के पास भेजते हैं, बाज़ वक़्त हम मेडिसिन देते हैं, HCQs, जो इफेक्ट हो जा रहा है कि आँख में देख रहे हैं। तो आई का बहुत बड़ा रोल है किडनी के साथ। बस जेनेटिक डिजीज रहता है बाय बर्थ, उसमें भी आइज देखते हैं हम लोग, एल्पोर्ट सिंड्रोम, बल्कि परसों बच्चा देखे अपन लोगों ने, एल्पोर्ट सिंड्रोम का था वो, तो डायग्नोस्ड बाय अ ऑफ्थल्मोलॉजिस्ट। सो इट्स वेरी इंपॉर्टेंट। तो जब भी आप कोई केस देखे, हर पेशेंट को शुगर BP रहता, आँख चेक कराए क्या भाई, नहीं करा तो एक बार चेक करा लो बोलना ज़रूरी है वो, it's very important. And many ophthalmologists also they tend to skip this fundus exam, पता नहीं क्यों, नंबर देख के छोड़ देते हैं। फिर मेरे को समझ में आया ऑप्थल्मोलॉजिस्ट नहीं रहता उन्हें, वो नंबर जाके बता लेते हैं, तो भी आँख बताओ बोले तो नंबर के दुकान पे चले जाता, सनग्लासेस के साबरीज पे जाके आँख बता लेके आ जाता, सॉरी उसका भी क्लिनिक हो गया था। तो इट्स इंपॉर्टेंट टू टेल देम टू मीट अ डॉक्टर, ऑप्थल्मोलॉजिस्ट बोल के बोलना, वरना ऑप्टोमेट्रिस्ट से इससे उससे मिल के करके आते हैं अपने लोग। सो मीटिंग द राइट पर्सन इज ऑल्सो इम्पॉर्टेंट। एंड टाइमली ट्रीटमेंट, लेज़र मारने से सब रुक जाता, लेकिन किडनी में अगर किडनी डैमेज हो गई, एक किडनी में नेफ्रॉन्स कितने रहते खदीर, नेफ्रॉन्स कितने रहते हैं फैज़ल? हाँ 100 मिलियन, ठीक है, वैसे अब ज़्यादा हो गया वो। 1 मिलियन नेफ्रॉन्स रहते हैं, फाइन, तो 2 किडनीज में 2 मिलियन नेफ्रॉन्स, तो 1 मिलियन लेजर तो नहीं मार सकते भाई सर, क्या है 50-60 लेजर के शॉट्स मार देते होंगे, वो सेट हो जाता है। अपन अब मिलियन लेजर फायरिंग करो बोले तो किडनी जल के इट बिकम्स इम्पॉसिबल, सो वी कांट डू दैट, बट इफ वी डायग्नोज अर्ली इवन बिफोर क्रिएटिनिन गोज अप, रेटिनोपैथी है तो ही इज़ इन हाई पोटेंशियल एंड सर डज द राइट थिंग। कई पेशेंट्स सर भेज दिया, मैं बोला क्यों भेजे होंगे, देन आई अंडरस्टैंड ही फील्स फॉर द पेशेंट, सी उसकी क्रिएटिनिन नॉर्मल है, उसको प्रोटीनूरिया बॉर्डर लाइन है, दैट इज़ द टाइम टू कंट्रोल डायबिटीज़ एंड फोकस रीनल प्रोटेक्टिव मेडिकेशंस, हिज किडनी वोंट फेल। अब किसकी किडनी फेल हो गई उसको जो भी करेंगे स्लो होगी बट रिवर्सिबिलिटी नहीं रहती, तो इट्स इंपॉर्टेंट टू डायग्नोज थिंग्स वेरी अर्ली। सिमिलरली इफ वी सी हो सकता है उससे रेटिना इन्वॉल्व नहीं हुआ होगा, इट्स इंपॉर्टेंट टू इन्वॉल्व ऑफ्थाल्मोलॉजिस्ट। थैंक यू सर फॉर अ डिटेल्ड थिंग। ग्लूकोमा सर कुछ
diabetic patients का ग्लूकोमा भी आने के चांसेस बहुत ज़्यादा है ना,
हाँ।
so how both are related to each other? When
there is
glaucoma already occurred, is it possible to get retinopathy also?
Yes. It's possible to get both things simultaneously. Glaucoma, mostly there is a type of glaucoma known as open angle glaucoma that happens more commonly in patients with diabetes. So every person who is diabetic more than 50 years of age should undergo a complete eye checkup. क्योंकि both diabetic retinopathy and glaucoma are like silent killers.
Cannot treat with the laser also.
Glaucoma also laser is there, but this not this laser. There is a different kind of laser.
So glaucoma is a very interesting topic. Somehow उसका ट्रीटमेंट नहीं है बोलते बहुत लोग, बट बहुत लोग है बोलते हैं उसको, we'll have it a separate session. But glaucoma is a thing which is treated by alternative physicians very commonly. Any chronic disease, alternative medicine goes in the picture because कुछ करो या ना करो कुछ suddenly होने वाला तो नहीं है, तो it's important to have the. I have seen many people putting eye drops, नंबर चले जाता होगा बोल के, बट वो जाता नहीं, बस स्पेसिफाई हो जाता है, साइकोलॉजिकल इफेक्ट रहता है, so it's important to have knowledge. पूछना चाहते हैं